Welcome back to the Health Priority Podcast. This podcast is sponsored by eClinicAfrica, making healthcare accessible and convenient for everyone. In today's episode, we will be talking about something very special to me because as part of Miss Health Ghana, I am taking on this project, which is self-medication. Today, I am honored to be joined by Dr. Kevin, who is a pharmacist. He will be taking us through what self-medication is, when it's okay to self-medicate and when it's not, and share with us some experiences. Dr. Kevin, thank you so much for joining us today.
You're welcome.
So, I am a first runner for Miss Health Ghana, and my project was on self-medication, and eClinicAfrica was like an innovation tool for me to, resolve, not 100%, but resolve self-medication. Like people will have to talk to a doctor before they self-medicate. So let's start with what is self-medication?
All right. So thanks very much for the opportunity. This is actually my first podcast, and so I do not take it lightly at all. Okay. And I appreciate the invitation to be here to speak on self-medication. So self-medication is a very common health problem that we encounter or we face in our day-to-day lives. Would say that self-medication refers to people taking medicines, usually over-the-counter medicines, prescription medicines, without taking or seeking health advice or seeking professional advice from a doctor or a pharmacist. And it's not a problem that only affects the general public, but then it's interesting to know that from studies, it shows that about 55.9% of health professionals even self-medicate. So even though they are health professionals, they are still not supposed to self-medicate. Usually they feel some symptom. There are some symptoms that run through a lot of disease conditions, something like headache, fever.
Yeah.
There are a lot of disease conditions that presenting symptoms would include that. And so once they have treated a particular disease condition, or they've treated headache in a particular disease condition and they experience the headache again, they just take the same medication that they were. But then you know that hypertension, when your blood pressure is even high, it can present as headache.
Yeah.
And so the best thing is to go to the hospital or a pharmacy and then have your blood pressure checked, have some vitals checked and all of that, so that you can uncover some of these underlying disease conditions before you go on to
buy a drug.
So it's a common problem and for everyone, and even health professionals shouldn't self-medicate as well.
So this is like a common practice worldwide. I won't just say here in Ghana, but here in Ghana, I think over-the-counter medications are a lot. So even if people have like headache, just chills, and their child is even sick, they can just walk to the pharmacy and they will complain about what is wrong with them or their baby, and the pharmacist will just give them a drug. But but is it, when we talk about this, like we creating awareness out there, are we destroying someone's business?
Yes, you're not necessarily destroying someone's business by creating awareness on self-medication. You're letting them know about the benefits and the dangers involved with it. I'm sure you've heard recently that kidney cases are on the rise and all of that.
Yeah.
It's one of the causes of these rising kidney cases are the use of NSAIDs. NSAIDs are like painkillers.
Yeah.
So once someone experiences pain in a particular part of their body, they just go for these painkillers and all of that. But then I mentioned earlier on that there may be some underlying conditions like high blood pressure that are resulting in these headaches. And so you need to have a thorough body check to uncover some of these things so you can actually treat them to prevent some of these things. So we need to create awareness, and it's very important
So that doesn't mean that you are destroying somebody's business.
No, you are not.
Yeah. Somebody will say that I'm actually in pain. Let's say I'm actually in pain, like so much pain. And at that moment, I really need to like subsidize my pain. And there is a pharmacy. Why don't just run to the pharmacy? Me going a long way to go and chat with the doctor or to go to the hospital to get prescription would probably like cause more danger. So like how would you like tell us like when it's okay and when it's not okay to take like these drugs?
Okay. So for this instance that you are given, it's okay for it to be given as a first aid.
Okay.
So you can self medicate. So going to the pharmacy actually is not self medication in
Okay.
quotes, because the practitioner will definitely, a very good practitioner will definitely tell you about you seeking further health care in the hospital, for them to carry out thorough investigations to uncover the problems that
Yeah.
you are facing. But it's okay to receive a painkiller as first aid for a throbbing headache.
Yeah. Okay. So that means that when you go to the over-counter medicine and you meet a pharmacist, he is going to like take you through some steps that you need to like get a prescription before you buy those drugs.
So for things like basic pain, you don't need a prescription to be
Okay.
given a first aid. That's why they allow the OTCMS, and these OTCMS, that's the over the counter medicine sellers, usually operate, or they usually run without pharmacists, because they are selling drugs of common occurrences. So you don't necessarily need, for prescription only medicines, you need to go to a pharmacy. And even with that, it's only a pharmacist that can dispense that prescription medicine to you. So these OTC operators, medical medicine counter assistants, pharmacy technicians, they are allowed to dispense painkillers,
Okay.
these blood tonics and all of them. But then if it comes to antihypertensives, anti-diabetics, you need a pharmacist, as they are prescription medicines. And so a pharmacist would have to be the one to dispense that to
Those.
you, and then they will take you through counseling and all. These to talk more about it, they are taking a lot of medications poses the risk of drug
Yeah.
interactions. And so it's very important that when you are having multiple symptoms, your tummy hurts, your head aches and all, you go to a pharmacy, speak to a pharmacist, or go to a hospital, speak to a doctor, so that they can counsel you on the drugs that you can take. They would advise you on how you should take the medicines to prevent some of these problems that occur taking.
Is there like an instance where you've come across somebody that has self-medicated and had led to like a lot of complications?
Yes, self-medication, it's a common thing in our setting.
Yeah.
It's a very common thing in our setting. So we always encounter people like that. People have had serious pain or chronic pain for 3 4 months, and they are at home just relying on
Herbal
painkillers,
medicines.
herbal
Yeah.
medicines, without having to go through the hospital because of cost challenges.
Distance.
Yes, and it's very convenient. They have friends and family recommending certain drugs for
Yeah.
them, and they decide to stick on those ones without having to do the right thing by going to a health facility for proper
Yeah.
investigations to be carried out, for them to actually
No the drug
know the
kind.
diagnosis, correct diagnosis, advise properly, and so it's a very common thing out there. When we see them in the health facilities every time, there are people who would come and they would say that they they don't know what happened, and they were there, and then they started realizing that they are not urinating in the
Yeah.
quantities that they should be. And upon investigations at the hospital, they tell them that their kidneys have failed, and they come and tell you that they are very strong, they are very energetic, they're able to work very hard and all. But
Wow.
then their kidneys were destroying due to maybe high blood pressures or other underlying conditions gradually. But because the symptoms that were presenting were mild, they decided to, let's say, take the normal painkillers to
Yeah.
subside the pain. When they take the painkiller, they feel okay and all. So they thought that everything was just fine within them until they started realizing that they are not able to even pee. And then once they get there, they carry the investigations and their kidneys are filled. And you know how much
Yeah.
dialysis and all costs.
Course, no.
So it's a very disheartening situation. And
During my undergraduate, when I took this project, I did it at Medina Hospital, and most of the common drugs that I encountered was antibiotics, especially the amoxicillin and um, amoxicillin, and I think the other type, I've forgotten, but the other types. And when I ask them why they are purchasing those drugs, they'll go like consultation fees at the Medina
yeah,
hospital is expensive. But if I have like 20 cities, I can just go over the counter medicine and just buy some of these drugs. So I think that when I was pitching my Miss Health Ghana, what I said was, if you consider the dangers of it, I'm sure that you would think twice
for
before
self-medicate. Yeah,
self-medicating, right?
that's
Yeah.
actually
But is
very.
there any other common drugs that you know that people like right now people are self-medicating with?
It's mainly the painkillers and the antibiotics that people are self-medicating with, because when it comes to the antihypertensives, even people do not want to take because of the notion that they have.
Yeah.
Some men feel like if you take an antihypertensive, you are going to lose your libido and all of that. So the main medications that people self-medicate are the painkillers and then the antibiotics. The antibiotics, some people are of the view that, oh, it's 6 months and I need to
Yeah.
clean up my system, and so taking an antibiotic is going to help clean up my system of any diseases or sicknesses in my body. But it's not so. Such practices lead to resistance, and currently there are a lot of um, cases of antimicrobial resistance.
Resistance, yeah.
You go to the hospital, someone has been given this a common antibiotic that should work for everyone.
Yeah. So I want to ask this. You see, most of our mothers, they want to, when they go to the hospital and they are being given the drugs, they want to combine that with the herbal. They'll be like, oh, I'll take the herbal one for 3 days. Then after 3 days, I'll take the other drugs. What advice is that good? Is it like safe to do that?
It's not right. Herbal, even if you want to take herbal medications, you need to seek advice from a medical practitioner.
Yeah,
And we have,
them in the hospitals
yes,
now.
and we have even a course in, I think, KNUST,
Yeah,
herbal medicine. So they take them through all of these things. And so they are in their best position to advise you. The problem with herbal medications is that you may have the precursors and the other things. They are all good. But then you may be boiling and drinking so much. But then, so let's take it as maybe this quantity or this volume is good for you. But then because you feel like the more quantities that you take, the more is going to work for you. You end up consuming so much
yeah.
and you end up hurting yourself
Leading to the kidney and the
and the
liver.
liver
Yes.
issues and all of that. You name them. So it's very important that even if you want to take these herbal medications, you need to seek advice from a medical practitioner.
Let's talk about the trending Ozempic drug that
Yeah,
we are using to do our
weight
yeah
loss.
weight loss. Is it really good?
Yeah, Ozempic. I'm not here to advertise for them
No,
or
no, no, no,
anything, but
no.
then it's work. It's work. So it was used for managing, I think, diabetes, right? And then they found out that the side effects of the drug was actually causing the weight loss and all that. So that's what made people.
But do I need to like see? Do I need to have a prescription for that? Because like people are buying it,
Yeah,
and it looks like they. I don't know if they are being prescribed for them to buy it.
the advice I would give is try to go the normal way, dieting,
Exercising. Okay.
exercising and all that. It's very cheap and safer because using these medications, medications have their good and their bad side. Long term, they may not be so good for the body. And so I think we need to explore the traditional ways of losing
Yeah.
weight compared to those, because you know that these medications, though they may be good in the immediate term, long term, they can cause a lot of problems sometimes. Okay, not all of them, but
Yeah.
then some of them have not really gone through the scientific trials and everything to ascertain their safety in some uses. So, like they are extra or added on uses. So, I think that it's best we just stick to the traditional ways of using
But
it.
I think that self medication we could have some precautions or like some preventions, right?
Yeah,
Right? Can you
self medication. What?
like let's
Okay,
say maybe we should advise people to like consider
the harmful nature.
their lifestyles, their stress levels, to not lead them to like take drugs in case like normally like when we stress out we get these headaches,
Mm-hmm.
then we just buy our painkillers and we are okay.
Yeah,
But is there some precautions that we can take like to, we are not going to prevent it 100%, but like prevent it like some,
or reducing
yeah,
the
reduce to
levels
the
of.
level of self
Okay.
medication.
So first of all, I would advise that we seek medical advice from a health professional at all times. What we are doing is also very good, making people aware of it. So creating awareness on our part is also going to help reduce the levels of self medication. So these two are very important. And also, when you encounter any disease condition or you are experiencing something funny or you are not feeling okay, make sure you always go to the hospital.
Yeah,
Don't
regular
wait till
checkups.
the last minute, because at that time you may end up with serious issues. So
I should have asked this initially. What's the role of the pharmacist and the over counter people we see out there?
so the role of the pharmacist or the OTCMS, I would speak for the pharmacist. It's good to purchase drugs from the OTCMS, the basic painkillers. But if you go to an OTC and they are selling an antibiotic to you, I think you should reconsider, because they don't even have the permission to purchase, or sorry, to purchase and then sell the antibiotics. Antibiotics need to be dispensed in the pharmacy. So make sure you do not buy antibiotics from an OTC MS. Make sure you get those medications from a pharmacy. And the role of a pharmacist in self medication, like what I'm doing, is to educate, to
Yeah,
counsel.
yeah,
So when you come to the facility, the pharmacy, and I'm present there, I'm going to advise you that I would first of all ask you questions on how you're feeling, and then based on that, I'll make an assessment. There, I'll advise you. Maybe I'll give you the normal first aid. You are experiencing headaches, I'll just give you paracetamol, like
yeah. I
start
understand.
dose, so that you take it there and then. But then I would refer you to the hospital, unless of course maybe you have gone to the hospital and then you've been put on that medication long
Okay,
term. Even with that, I'll advise that
you go for
from time
review.
to time
Yeah,
you go for reviews in the hospital to know whether you should keep being on those medications or you should stop them. So yeah, our role is very simple: to counsel.
we've talked about most of the common drugs like the antibiotics and the painkillers. You know, with antibiotics, most of our mothers knows that like and most of us even things that antibiotics are used to treat cold. Like a general, we all know that oh, when we have cold, you can get antibiotics, then we are good to go. But is it really like good? Like is antibiotics really solely for treating cold?
No, it's not solely for treating cold. Antibiotic is used in a lot of settings or used for a lot of things. When you are carrying out surgical procedures, you are given antibiotics. When there are sepsis, antibiotics are used in sepsis. Antibiotics are used in many disease conditions. So it's not solely used for cold. Even with the cold, you need to ascertain or determine the cause of the cold before you introduce an antibiotic, because not all colds are treated with antibiotics. So you need to ascertain the cause of your cold before you stick to these antibiotics to prevent situations of resistance, because there are situations where you really need the antibiotics, and because you've been consuming them like
there'll be some resistance.
the food that you eat every day, and so the time when you really need it, culture and sensitivity might end up telling you that you become resistant to the basic common ones that are not even expensive, and so now you have to go for the very expensive ones, and the financial status of our country
and by then
that,
too, the disease has escalated. For instance,
yes.
tuberculosis. So that means that the antibiotics that are meant to like treat you are now causing harm to you.
Exactly. So we need to be very, very careful when it comes to self-medication. And
is there any tips that you want to give to anybody who is thinking of self-medicating?
What I'd say is that your health is your valuable asset, and so you need to really take good care of it. Always speak to your health practitioners. Visit the hospital for regular checkups. When you are feeling funny, make sure you visit the health facility and then get medical advice. And I also advise that at least if you have the capacity or the financial muscle, at least twice every year you need to run a thorough body checkup to know how your organs are faring, your cholesterol levels, your sugar levels, and your blood pressure should be checked if you can, check it every week. Just walk into a pharmacy, they wouldn't take any money from you, and then have them.
They take like 10 cedis, 5 cedis.
Okay.
Yeah.
But most of them, they don't take anything. So make sure you walk into a pharmacy today and then have your blood pressure checked if you are not checking those things. And then make sure that at least once a year, you run a full body checkup to know how your organs are faring, everything. So that you detect any pending dangers and then curb them before they turn into something else.
Yeah. Thank you so much for the insight today.
Thank you very much.
eClinicAfrica is a health platform. Like it's both it offers virtual and physical healthcare services. So the health platform, the virtual health platform has it's just like using WhatsApp or even Netflix. So you get to download, you connect with a doctor, then you chat with the doctor with any symptoms you are having before thinking of, okay, I need to go and buy this drug to cure that symptoms. Yes. So thank you so much for joining us today. And thank you to all our listeners. Don't forget to subscribe to our YouTube channel and follow us on all social media platforms, the Health Priority Podcast. See you.